Hi, welcome to our OSMC Total Joint class. We've got a great deal of information that we're going to be giving you today. We're going to cover several different topics. So some of the topics we're going to talk about today include the support system and resources, nutrition, medications, incision care, your surgery center experience, durable medical equipment, therapy, home organization and safety, and exercises and expectations. So the role of your coach and your support system really is not so much helping going to the bathroom or showering. It's more help giving you moral support and encouragement, giving you a ride to and from therapy, helping make sure that you have meals ready for you, chores around the house, helping with your pets, because pets take a lot of work too, and making sure that you're doing the things you should be doing, and also kindly reminding you when you're doing things you maybe shouldn't be doing. So the next thing we're going to talk about is nutrition. And nutrition is very important going into and coming out of total joint surgery. We know that better nutrition equals better healing. Protein is extremely important. Studies show that the majority of patients going into total joint surgery are deficient in protein, and protein is very important for healing. Helps to replace any blood that's lost, helps heal the skin, the nerves, the muscles, the bones. So it's very important that we focus on that protein intake both before and after surgery. Hydration is also very important going into your surgery and after surgery. You should be drinking at least 64 ounces of water per day. That's 8-ounce glasses of water. Especially in the couple days before your surgery, you want to make sure you actually drink a little bit more than that to make sure that you're nice and hydrated for the day of surgery. Diabetic control is also very important. People who are diabetic or borderline diabetic are shown to have a little bit longer healing time and have a little bit higher risk of infection after surgery. So controlling your blood sugars as best you can going into and coming out of surgery is really going to help maximize your ability to recover after. Fiber is also very important for your diet. Fiber will help to promote your bowel function, which is very important because some of the medicines we use after surgery do cause some constipation. So increasing your fiber intake will also help. This is a picture of the Ortho Nutrition Bundle. It's enhanced medical nutrition. Like I had mentioned, the majority of patients are deficient in protein going into surgery. This weeks before and 2 weeks after your surgery just to help ensure that you have the protein that you need for your recovery. So some of the most common questions that I get during pre-op appointments is about medications. And most common is the questions about pain. What am I going to do for pain after my surgery? The way that we approach pain is through something called a multimodal approach, which means that we kind of try to attack pain from all sides. We don't just take one pain medication and say, here you go, hope it works. We try several different ones that target different types of pain to try to make you as comfortable as possible. First, what we do during your surgery is we give you an injection of a medication called Exparel. This is a numbing medication, kind of like when you go to the dentist, and it numbs you up. Only this medication lasts for about 48 to 72 hours. So 2 to 3 days, this should help to take kind of that edge off the pain. We also have the option of using Tylenol after your surgery, as well as an anti-inflammatory if you're able to take those. We will prescribe one for you. The two most common pain medications we use are Norco and Tramadol that you can also use after your surgery. If you have an allergy or a contraindication for one of these medications, we can make some substitutions to make sure that we have your pain nice and controlled. You did have surgery, so you are going to have pain. You're not going to be 100% pain-free, but what we are going to do is try to make you as comfortable as possible. If you're trying all of these things, all the different medications that we've given you, you're using ice, and still your pain is persistent, it's not getting any better, please give us a call so that we can see if there's something else we can try for you, or we may bring you in the office and see you and kind of figure out why your pain is not controlled. The next common question I get is about blood clots. Everybody worries about blood clots after surgery. You are at an increased risk of developing a blood clot within 3 months of any joint replacement surgery. If you are currently on blood thinners like Coumadin or Xarelto, we usually have you resume those anticoagulants the day after your surgery. If you are not currently on any blood thinners, we usually have you take a baby aspirin, that's 81 milligrams of aspirin, every day for 90 days after your surgery. The other most important thing for you to do after your surgery is you need to get up and you need to walk for at least a few minutes every hour. When you're asleep, that's okay. You don't have to set an alarm and get up in the middle of the night to walk. But when you're awake during the day, you need to be getting up and walking for at least a few minutes every hour. That's going to be the best thing to help prevent you getting blood clots. If you sit down in the recliner and put your legs up and stay there for 3 days, even if you're taking aspirin, even if you're on blood thinners, you're going to have a high risk of having a blood clot. So getting moving is very important. I briefly mentioned stool softeners before. Again, high fiber diet, very important. Green leafy vegetables, stone fruits like prunes or apricots. Coconut water is actually a nice natural laxative as well. Drinking plenty of water, like I mentioned before, 64 ounces at least per day. We will prescribe you a stool softener as well to help. If you're going okay, you don't have to take it, but it's there if you need it. You can expect to have your first bowel movement about 2 to 3 days after your surgery. Very important to know, prescription refills. You can call us by phone, leave a message, we can get a refill in for you if you need it. What I strongly recommend is if you're getting close to the weekend, count out all your pain medication, all your other medications, make sure you have enough to get you through the weekend to at least Monday. If you run out on a Saturday, there's nobody here to refill it, so you won't be able to have that medication. So make sure you count it out so you know you have enough to last you through the weekend. If you're going to run out, please call our office no later than noon on Friday so that we can make sure we get the medication in for you. Sometimes medications are back ordered at a pharmacy or a provider may be out of the office. So this way, if you call early, before noon, we can make sure that we get it in for you. If you call at 4:59, you're probably going to be out of luck until Monday morning. You can request prescription refills through the patient portal, but that does take a couple days. You can also do mail order, but that takes about 7 to 10 business days. Next, we're going to talk about incision care, kind of what to expect about your incision and kind of when to be concerned. This is a picture that one of our patients very graciously allowed us to take of her knee. She had a total knee replacement that was robotic assisted, which is why she has not only the tapes across the knee, but she has some crisscross tapes above and below the knee. If you are not having a robotic assisted surgery, you will not have the crisscross tape incisions. If you're having a partial knee, it will look very much like this picture, only about half the size. And if you're having a total hip replacement done, it will look like this, but higher up on your leg. What to expect? You're going to have swelling. You just had surgery. That is normal. Elevating your feet, putting ice on the hip or your knee will help with some of that. Your incision is going to feel a little bit warm immediately after surgery. That's part of the inflammatory process and very normal. You may have a little bit of drainage from the incision. Sometimes we can have a little bit of spotting or a little bit of bloody drainage that usually only lasts for about the first 24 hours and then typically stops on its own. Things to be concerned about: if you have a fever over 101, and I say 101 for a reason. After we have a stress to our body, which surgery is a stress, it causes an inflammatory process to occur within the body. That inflammatory process increases our core body temperature and typically can increase our core body temperature by 1 to 1.5 degrees. So if you take your temperature the day after surgery or a couple days after surgery, it may be 99, it may even be 100. That is pretty typical. If it gets to 101 or higher, that's a little atypical and you need to give us a call and let us know. You may notice redness over the incision. If you do, please give us a call. I like to describe it as kind of angry looking or fire engine red. You may notice an increase of drainage, or if there's a smell or a funny color to the drainage, please give us a call. If you have an increase in your pain all of a sudden and you're using the medications and nothing is helping, let us know. Please remember that we do give you that injection of numbing medicine that lasts for 2 to 3 days. So if you had surgery 2 or 3 days ago and you start to notice, hey, I had no pain at all and now all of a sudden I'm having a little bit of pain start to develop, it's probably just that the medication has worn off and it's time to rely more on the oral medications to control your pain. If you notice an increase in swelling, your entire leg swells up, or your knee was a little bit swollen but now it's very big, please give us a call and let us know. I tell all my patients peace of mind is priceless. So if you have anything that you're losing sleep about, you're wondering, hey, is this normal? Hey, is this okay? Please give us a call and ask us, or come and schedule an appointment to come in so that we can look at it and give you some reassurance if everything is okay.
I'm going to talk to you about your time at the surgery center. We have 2 surgery centers, the Surgery Center of Granger and the OSMC Outpatient Surgery Center in Elkhart. You will arrive at the Surgery Center of Granger and check in with the reception staff. When you're going to the Elkhart Surgery Center, you will drive to the back of the building where our Elkhart Clinic is and park in the back where it says Outpatient Surgery Center. I'm going to talk to you about your time at the surgery center. We have 2 surgery centers, the Surgery Center of Granger and the OSMC Outpatient Surgery Center in Elkhart. You will arrive at the Surgery Center of Granger and check in with the reception staff. When you're going to the Elkhart Surgery Center, you will drive to the back of the building where our Elkhart Clinic is and park in the back where it says Outpatient Surgery Center. I'm going to talk to you a little bit about how we want you to prepare for your surgery. The night before surgery, we want you to sleep on clean sheets and wear clean pajamas to bed. Avoid sleeping with pets. The reason for this is we do not want any nicks, cuts, or scrapes in your skin because it could increase your chance of getting an infection. You need to shower the night before and the morning of surgery using the Hiblican soap. You can purchase that at any local pharmacy, and you can follow the steps in your getting ready for surgery guide. Please do not put any creams, lotions, makeup, or perfume on after you have showered. The lotions can cause issues with the prep that we use for your skin before surgery. Please brush your teeth the day of surgery. No shaving your lower extremities for a week prior to surgery. Again, this puts you at risk for putting cuts in your skin, which could increase your risk for infection. If you do need any hairs clipped, we will use surgical clippers when you arrive to the surgery center. The night before surgery, we do not want you eating anything after midnight. Regardless of what time your arrival time is for surgery, you should have nothing after midnight. The exception to this is you can have clear liquids up to 2 hours prior to your arrival time. Clear liquids is anything that you can see through after it goes to room temperature. So apple juice, Gatorade, water are all things that you can drink the morning of surgery. Please do not have any milk products, and you need to stop drinking anything 2 hours prior to your arrival. So if you're scheduled to be at the surgery center at 7 a.m., nothing to drink after 5 a.m. If you do decide to participate in the nutrition shake program, you may drink the carbohydrate supplement the morning of surgery. Again, that needs to be 2 hours prior to your arrival time. You are welcome to bring virtual devices such as cell phones, earbuds, tablets, to keep you busy while you're waiting to go into surgery. We do ask that you leave all jewelry and any other valuables at home. Please, if you have a ring that is hard to get off, go see a jeweler and get it removed before you come to surgery, because we will have to cut off your ring if you come with a ring the day of surgery. You'll check in at the surgery center front desk. Please bring your insurance card, your picture ID, and prepayment if you were told you have one. It is also very important that you bring a walker with you. We need to be able to have you walk with your walker before you leave to go home for the day. So please make sure that is with you and you bring it inside. Once you get into pre-op, we're going to have you change into a gown. We'll have you sign some consents, start an IV, and give you some medications. You will also meet with your anesthesiologist before surgery to discuss the type of anesthesia, allergies, and your health history. If you have any additional questions about anesthesia, you can visit our website, osmc.com, for more information about your anesthesia choices. You can basically do it one of two ways: general anesthesia, where we give you medications through your IV, you go off to sleep. After your sleep, we do put a gentle airway in to keep you breathing. You do not know that's there, other than you may have a scratchy throat after surgery. The other option is spinal anesthesia, where they numb you from the waist down. You are awake during surgery, although we can give you medications to help you be sleepy, but you're completely breathing on your own. What you decide to do for anesthesia is up to you and your anesthesiologist, what's safest for you. You will also meet with your surgeon the morning of surgery. This is the perfect time to ask any last minute questions that you might have for the surgeon. The surgeon will come see your family member after surgery, but they will not necessarily speak with you, because the medications that we give you during surgery can give you an amnesia effect where you won't remember much probably after you go back into the operating room. Once you arrive to the surgery center, we will take you back to pre-op. Your loved one is allowed to go back with you and wait if you would like them to. We're going to ask you to completely undress and change into a gown. If you're having your knee done, we will give you some paper shorts to wear. If you're having a hip, you will be completely undressed. We're going to get an IV started. It's very important that you hydrate well 1 to 2 days prior to surgery. We always tell you should drink 8 glasses of water a day. That's especially important before surgery. Hydration helps with nausea after surgery, and it also helps your veins be more accessible for the IV. We will give you some antibiotics through the IV. We're going to start you with some medications when you arrive: gabapentin and Tylenol. You will take these with a small sip of water. These are part of our multimodal program, and they will help with your pain control after surgery. We're going to ask you many times to verify your name, your date of birth, your allergies, and what you're having done. Anytime you see a new care provider, they will be asking you these same questions, and that's just because we want to make sure that we're doing the correct surgery on the correct patient and we are being safest as possible for you. We will ask you to empty your bladder before you go back to surgery. The surgeon and you are both going to mark the site of your surgery in pre-op. You will put your initials, the surgeon will put his or her initials. That way we know we are all in agreement that we are working on the correct side. We will place a sequential compression device, or an SCD, on your non-operative leg. This will be hooked up to a machine while you're in surgery. It inflates and deflates, and it's to help prevent blood clots. The OR staff will take you to surgery on a stretcher. At this time, we will ask that your loved one wait in the waiting room. We will come and get them when you are all done with surgery and back in the recovery room. Once you get into the operating room, we will have you scoot over to the operating table. The ORs are cold, however, we will provide you with warm blankets. We will have several things we need to accomplish before you can go home. We want to make sure that your pain is under control. I do like to say that you are having surgery, so you're going to have pain. We will not get you completely pain-free. Our goal is to get you as comfortable as we can so that you're able to get up and go home, and then you're also able to get up and go to the bathroom and do your walking as necessary. We manage your pain many different ways. Number one is the medications that we give you prior to surgery orally. And then the anesthesia provider will give you medications through your IV to help you throughout surgery. After surgery, we will start you on your oral pain medication once we get some food in your stomach. Again, we want your pain to be as under control as it can be, but you are going to have some pain. We also give you a medication while you're in surgery that's injected into your joint. This medication, it spreads as you get up and move around. So once we get you up and walking, it will help with your pain as well. We want to make sure that your nausea is minimal or non-existent. Unfortunately, some people are just prone to nausea after surgery. We can attack that in a few different ways. The anesthesia provider can give you medication prior to surgery, as a preventive measure to hopefully help with any nausea after surgery. We can also give you medications through your IV after surgery, and we can also send you home with a prescription for nausea medicine if needed. We will have you walk with your walker before you leave the surgery center. It is encouraged to have a walker that does not have any wheels for your safety. It is okay to have a walker with wheels if that's all you have. Your home meds will be arranged for you to pick up at your pharmacy. If you see Julie or Megan prior to surgery, those medications will be called in the day of your pre-op appointment. If you do not see one of them, then the prescriptions will be sent in the day of surgery by your surgeon. Please make sure that your loved one knows that they will need to pick these up before you go home. We will have you use what's called an incentive spirometer before you go home. This is a little device just to help you expand your lungs and keep your airflow running smoothly. Anytime you have surgery, you are at an increased risk of pneumonia. We want to make sure that you're remembering to take good deep breaths. The nurse will go over your discharge instructions with you and your family. We do ask that your driver must be over 18 years of age, must be able to understand the instructions so that they can help take care of you when you go home. All of the discharge instructions will be written down for you to review once you are out of the anesthesia, but please make sure that the person that's coming with you is able to understand those instructions so that you are able to be taken care of. You will stay in recovery for a minimum of 2 hours. If you have sleep apnea, you will have to stay with us a little longer.
Hi, today we're going to be going over some key aspects of your post-op recovery that are going to help you to have a very positive outcome after your surgery regarding physical therapy and your mobility. Some of you are going to have some precautions regarding your specific type of surgery, especially hip replacements. We'll go over those in a little more detail in just a minute. We're going to give you 4 exercises today that we would like you to do starting after you get home from the surgery center and you get home and get settled. There's going to be 4 exercises we'd like you to do at least 2 to 3 times per day. They shouldn't take too long, but they're definitely going to help to improve your mobility and get you ready for your first formal physical therapy appointment. These exercises, again, we'd like you to have you do those 2 to 3 times per day. Outside of those exercises, we prefer that you use your walker every hour to 2 to get up and walk around your home a little bit, just so you don't get stiff. Probably the worst thing you could do after a surgery like this is to not move and to sit still. So we prefer you to get up and use your walker and move around a bit. Conversely, we don't want you to get up and do laps around your house or walk around the block. But do get up and walk around a little bit every hour to 2 outside of your exercises. When you're done with those exercises, we like you to use some form of ice therapy, whether it's the ice machine or a cold pack. 10 to 15 minutes or so definitely helps to decrease your pain and inflammation. So those are done after your exercises. Your first formal therapy appointment inside a clinic will be 3 to 5 days after your surgery. That is called an initial evaluation, and that is key to set a plan of care and to establish some goals to get you back to doing what you really want to, whether it's work or any kind of recreational activity. So that usually happens 3 to 5 days after your surgery. Please make sure that that appointment is scheduled in advance so we're not having a delay in your rehab. At that first therapy appointment, you will have a new exercise program that's going to take over from the exercises that we're going to go over today, the 4 that are given to you now. Those are going to take over and are going to be specific to your personal rehab. Those are going to be done 2 times per day, 2 to 3 times per day, and you're going to be coming into the clinic for your formal therapy appointments 2 times per week. home safety is definitely a concern. You want to make sure that you don't have any accidental trips or falls. And so these next few items are to go over that and make sure you have a safe transition back into your regular activities. If you have a house that's more than one floor, ideally if you can stay on one floor so you can do your exercises, your eating, your day-to-day activities, rather than going up and down steps, that is preferable. But if you have to go up and down steps, it is okay. Just be careful and use the up good, down bad method that we discussed later on in the exercise section. If you have steps into your home, please use the up with the good, down with the bad routine. Use a strong arm or a railing to assist you up into your home, not your walker. If you have things in your way of your hallways, such as electrical cords or throw rugs, maybe a rolling chair, please try to remove those so they don't inadvertently trip you up. Sometimes a night light is helpful for nighttime bathroom breaks, or if you just have to get up and move at some time in the dark so you can see where you're going. Pets, sometimes your pets can trip you up, and that is definitely a concern, so please have your coach take care of your pet as far as feeding and potting and watering them. Make sure that they get the exercise they need, and you will get back to helping them soon enough, but try to have someone help you with your pet in the meantime. Some other comfortable things to have on hand are like non-skid shoes or slippers. Definitely makes things a little bit easier for you to not have to lean forward and tie shoes. That may be a big challenge. So a good comfortable pair of non-skid shoes or slippers is helpful. Other things that might be helpful in this situation are a list of emergency numbers nearby in case you need to get a hold of someone if your coach isn't nearby. That's always nice to have on hand. A couple other items that we don't carry in our DME department, but you can find at a home medical store, is a shower chair or a raised toilet seat. Those can be very helpful if you have to get in and out of the shower. The shower chair is very safe, so you can sit down and scoot over rather than stepping over a tall threshold in a wet environment. That is definitely a safer bet than stepping over a threshold. If you're having a posterior hip replacement, or if you're having like a knee replacement and you're having trouble getting down into a lower seat, a raised toilet seat is sometimes very helpful for that in the short term. If it is a snowy or wet season, please make sure someone is taking care of your sidewalks so that when you have to go out to your therapy appointments or your doctor's appointments, you're not necessarily going on an unsafe surface to walk on. So be careful of those wet floors. Regarding precautions in postoperative therapy, please use your walker at all times when you're up and about. It just makes for a safe environment so that you're steady on your feet, because your leg will not be quite as strong as it normally is, and you want to make sure you're able to ambulate safely. So please use your walker, preferably without wheels, to get up and walk around. Your therapist will determine when it's safe to transition to a cane or to no assistive device at all, but please do use your walker when you have to get up and around. Regarding driving a car, that's a variable that is determined by if you're taking pain medication or if it's your driving leg. So you have to look at whether or not you're taking strong narcotics or if it's your driving leg. If it is those two cases, then it's going to take you longer to get back behind the wheel. Your therapist and doctor can talk to you about when it is safe to get back behind the wheel. If you're going back to a job outside of your home, your therapy can be scheduled to help work on exercises and activities that will get you back to your job as quickly and safely as possible. Regarding postoperative precautions, especially for hip replacements, if you are having a posterior hip replacement, you're going to have 3 precautions, and these are all outlined in your folder as well, so you can reference them as well from there. But as far as a posterior hip replacement, you do not want to raise your surgery leg up past 90 degrees at your hip. And that can occur whether you're lifting your leg upward toward you or you're sitting down and leaning forward toward your leg. You do not want to go past 90 degrees at your hip. The second precaution is to not cross your midline of your body with your leg. So you do not want to cross your legs, especially your surgery leg, over toward the non-surgery leg. The third precaution is to not internally rotate your leg. So if your leg is straight out in front of you, you do not want to turn your toes inward. So if you are up on your feet walking, you want to make sure that if, say, it is your right leg that's the surgery side, you want to turn your leg outward a little bit first and then use your walker to turn to follow. You don't want to pivot on your right leg not moving. If you're having an anterior hip replacement, you have two precautions. You do not want to take your surgery leg backward behind you and turn it outward. So lunging onto your opposite leg is something that you won't want to do for a while, but you do not want to take your surgery leg backward or behind you with an anterior hip replacement. These hip precautions are not for life. Your surgeon will determine when it is safe for you to discontinue using these hip precautions.